Okay, this is Andrew Bennett again, moving on to the third pillar of clinical faculty, talking about teaching tools now. Um, you know, I've been around some incredible teachers. I've been around some very bad ones too, both in and outside of the physical therapy realm. I think I have been both. I have been effective, good teacher, and I think I have been a bad teacher at times. And so I've really, it's out of the desire to be better that I started collecting a lot of data and information on how to become better at teaching. And so I've just tossed a few ideas onto the Moodle platform. Some of you that are much more experienced and better at this than I am, I'm really looking forward to what you're going to be adding here so that we can have some resources for better teaching. I'll give you through an idea of a couple of things that I have loaded on the Moodle platform. Probably one of the absolute most helpful things for me was this idea of the four quadrants model. Now, this actually comes out of situational leadership. It talks about the four quadrants of leadership, but it's really it makes a lot of sense when you look at teaching. So I'll just walk you through it real quick. It's actually embedded into the Being Better at Helping PowerPoint that we did back at AOMPT. But let me just give you a quick idea of what this is about here. So these are four quadrants of learning. If you look at quadrant one down here in the bottom right, and then it moves across the screen in a counterclockwise direction. So directive. This is the intern when they show up at your site day one. You really don't need to give them a lot of emotional support. You need to give them a lot of directive instruction. Move here, put your stuff down this way, learn the Moodle platform, learn where the patients come in, where the exam room is. This is how I want you to write your notes, that kind of thing. Integrative is the next step. This is when you're still giving them directive instruction, but the tasks have changed, and so the emotional support needs are also different. This is when you're asking them to go ahead and take on some patient responsibilities. Hey, this is Jim. Jim is a total knee patient. Why don't you go ahead and take him through his exercises? And you know what? Feel free to make some adjustments if you think he's ready. I think you know what you're doing here. So again, just a little bit more emotional support, but still highly directive. Now, synthesis is when it changes again. Synthesis is when you really want to back off the amount of information that you're giving them in terms of their own decision, but you continue to stay right at their elbow, so to speak. You continue to give them a lot of support. This might be when they're moving into the new patient exams, when you've given them the directive tools, but now they need to put them together. They need to use the hypothesis-based reasoning model that we've taught them and use their physical exam upper quarter, lower quarter tools that we've taught them and put them together to come up with sort of an assessment. But they're going to need you to validate them. They're going to need you to say that they're on track or off track. They're not ready for you to remove the emotional support. And then finally, when you get into the peer learning, this again is ultimately where we're shooting for, is to bring these interns into the situation where they don't need your directive input and they really don't need your emotional support. They can look at the problem, look at the patient very objectively and openly and not be fearful that they're going to be wrong, or really, quite honestly, they don't really care if they're wrong. They want to learn from you. They want to challenge you and at a much more of a peer level. This is really where most of our fellows should be. Now, what's helpful for me about this is that at any given moment, with any given scenario, one of my interns may be in a different quadrant. So, for example, I'll use the same intern for these examples. So we have an intern who is ready to start on a physical exam, and they've completed the historical exam, but they have not been signed off by me or approved by me from a competency standpoint on the lower quarter exam. So in my mind, I'm already thinking I expect this person to either be a quadrant 2 or quadrant 3 learner here. So depending on how they perform in the lower quarter exam on this patient, I'm going to either provide increased directive or decreased directive. But my emotional support, yep, that looks great. Good. Yes, your hand placement, look, that's a good job on controlling the foot on that. Those are going to stay consistent. Okay. Now that very same individual, we may be working on a necking patient that same afternoon, and we need to do some rotational mobilizations. And for whatever reason, this intern is their eyes get big, they start getting really nervous, they're not really sure what they're doing. Well, I jump right down into quadrant 1, directive instruction, low emotional support, right? Here's what I want you to do. Put your hand on find the articular pillar. Now, take your right hand, slide it around. Now, and so do you see how you've gone into that same intern went from quadrant 3 to quadrant 1 in about an hour. They went backwards, so to speak. But this tool has been very helpful for me because at any given scenario with any given patient, if I pick the quadrant that the intern is in at that time, my response back to them is usually a lot better. All right, so again, this comes from the PowerPoint Being a Better at Helping. That's also loaded in the Moodle platform. Moodle platform, where is it? Right here. So underneath the teaching tools, there's the actual articulated version, and here's the PowerPoint for yourself. So you can feel free to use that. Learning styles, understanding that my vocabulary has to change based on the learning style of a patient or of the intern. I can't talk in technical jargon if I have an allegorical learner. They need a story. They need a word picture. And learning what type of style of learning my intern has. Are they experiential, right? Do they want to discover it themselves, or are they very dependent? They want me to describe it, they want to see it, and then they want to reproduce it. So those are some things that I think may be helpful. Another thing that's not listed here, and I'll go back and add that, is the Strengths Finders 2.0. It's done through the Marcus Buckingham and the Gallup organization, of what are the natural talents, what are the recurring patterns of thought and behavior that the intern has. So again, just some ideas there on the teaching tool standpoint. These last two comments here are leveraged to teach by making your interns immediately useful. I would encourage you to let your interns know up front you really want to teach them, but they have to create that time. If they want you to help them, they have to be useful for you. So the way I typically start is by having them write my notes. It's low effort. It's quadrant 1. Do it this way. I don't have to be emotionally supportive. But if they can write my notes, then that's a huge chunk of my day that within the first week they're efficient, And now I've got extra time, and we can start talking about how to do the physical exam or how to do a history. So again, I would encourage you to find ways to make the interns useful, which then leverages your time and ability to spend teaching them. So again, looking forward to hearing from you as we collectively build the next generation of physical therapists.